Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health. Welcome to this module in Environmental Toxicology, and today we will discuss on teratogenesis. I introduce myself as Dr. Sushmita Bhaskar, working in the School of Interdisciplinary and Transdisciplinary Studies, Indira Gandhi National Open University. We have learnt about toxicants and toxins and how they exert their deleterious effects on the organs. Some toxic substances, they can penetrate the placental barrier and bring about the birth defects, especially in the developing embryo and the fetus, and they bring about lot of malformations that can cause mental retardation, paralysis of the limbs, congenital heart defects, cleft palate, visual and auditory disturbances. So there have been numerous reports which have shown that even the drug thalidomide, this was given to the women to treat the morning sickness, when they had severe headache and nauseating syndromes. And those women, when they consumed this thalidomide for a few weeks, that caused teratogeny and it caused birth defects in the children that were born to these women. In the same way, Bhopal gas tragedy and endosulfan pesticide poisoning, this also induced the teratogeny among the human populations. Let us now learn about the various teratogens, some concepts in teratogeny and their mechanisms of action. The learning objectives of this module. After listening to this module, you should be able to define teratogens and teratogenesis, understand the principles underlying teratogenic effects, explain the sources of teratogens and their effects, and describe the mechanism of teratogenesis. Let us now go on to understand some definitions which are used in the field of teratogens and teratogenesis. Developmental toxicity. This is caused due to any morphological or functional alteration caused by chemicals or any physical insult that interferes with the normal growth, homeostasis, development and differentiation and or behavior. Teratology. This is a specialized area of embryology that focuses on the study of the etiology of abnormal development, and it is also known as the study of birth defects. Teratogens. These are the toxic agents, xenobiotics, that bring about the malformations in the developing fetus. Malformation. This is referred to as a primary structural defect which is arising from a localized error of morphogenesis. Congenital malformation. These are structural defects that are observed at birth, and they may be gross or they can be microscopic in nature. It can be on the surface of the body or within, and it can be due to hereditary and non-hereditary reasons and so on. The principles in teratology. So this was proposed by James Wilson in 1959, and the teratogens can be organ specific, dose specific and also species specific. The susceptibility of a fetus to teratogenesis, it depends on the genotype of the embryo which is interacting with the adverse and the toxic environmental factors. So the genotype is first important. Teratogenesis, it is related to the stage of the development of the fetus when exposed to the toxicant. So in certain cases you will see that one drug, maybe in the first trimester or in the second trimester, the stage of the gestation and the stage of the development of that fetus when that is exposed to the toxin, that is highly important. Teratogenic agents, they have well defined mechanisms for producing the toxic effects. The type of the compound is important factor, and that will determine its path to the developing fetus. Teratogenesis is characterized by death by malformation, by certain structural and growth retardation, functional defects and so on. The extent of the altered development will increase with the increasing dose that the individual has taken. Stage of exposure to the teratogens. So in most cases, the stage of the exposure of the developing fetus, that is very important and primary, and the stage of the pregnancy is important for the effects of these teratogens to be noticed. So therefore, the process of embryogenesis itself is highly complex, and it involves cell migration, then proliferation, differentiation and finally organogenesis. Now here you see from day 1 to the last day, maybe for example in this figure we have given up to the day 15. So you can see the different forms when fertilization, then cleavage, then differentiation and so on, how all these up to the organ formation, from the pre-implantation, implantation and then finally to the embryogenesis and the organ formation stage. There are so many stages that are occurring in the life cycle and the development of a fetus. So at any one of these stages, if the person, that is if the lady is exposed to a toxicant, biological, physical radiations, that is why to women they always say that whenever there is any eclipse, solar or the lunar eclipse, they are not supposed to go out and get exposed to these radiation, because you never know what kind of an effect that can have on the developing fetus. So like that, even also the type of food that they are consuming, that they are taking, the type of medicine, even those who have blood pressure, the doctor takes a lot of importance whether she is administering the kind of, whether it is the kind of medicine that she is giving to the patient, because what kind of effect that can have on the fetus, that is an important factor. The same way the mother also, because everything through the placental barrier and through these cords, easily any chemical or any toxicant, anything that the mother is inhaling or ingesting, that can easily be transferred to the growing child. So therefore these are the processes that occur till the stage of the organ formation. Now this is the human embryonic and the fetal development. Here you see from the fertilized egg to the stages, like for example you have the 4-cell stage, you have the 8-cell stage, the 16-cell stage, the blastocyst. In the same way you can see the fetus of 4 weeks old, 10 weeks old, 16 weeks and finally 20 weeks. So therefore this stages we can classify them as from the pre-implantation stage, the implantation stage to the organogenesis stage, and the fetus from the fetus to the neonatal stage. So the outcomes associated with the exposure during each of these stages will definitely differ, and also from person to person. Exposure during the pre-implantation stage, that will cause embryonic lethality. So therefore that would be that will cause death to the child or the fetus that is growing inside. Exposure to the teratogens during the implantation to the time of organogenesis, that is once it is implanted firmly and then till the organ formation takes place, then you can have morphological defects. Exposure to the teratogens during the fetus to the neonatal stage, there you can have functional disorders like hormone disorders, growth retardation, intrauterine growth retardation and so on. Then the most critical period is the time of organogenesis, when the organ formation takes place. You can see that some children, they may have amelia, that is where a limb is not there, it is not present and so on. So the organ formation stage is very important, and that is a critical period. Sources of teratogens and their effects. So therapeutic drugs. One example that we had already given was thalidomide. This was a sedative drug. It was used in Europe from 1957 to 1961. So the drug was used for insomnia, that is sleeping sickness, and nausea, morning sickness, vomiting and so on associated with pregnancy. It was widely used by the women in Europe, in Australia, Asia, Africa and also the America. Then later on it was observed that the women who had consumed this drug in the first trimester, they gave birth to the children who had certain abnormalities. The birth defects were the absence of limbs, amelia, phycomelia, that is severe shortening of the limbs, absence of the auricles creating deafness, muscular defects of the eye and the face, malformations of the heart, bowel syndromes, uterus and also the gallbladder. Finally, this compound was withdrawn from the market in 1961 because of the so many of the effects that were observed. Accutane or isotretinoin. This is a drug that is belonging to the retinoid group of drugs. It is related to vitamin A. Now normally during the period of the pregnancy, the women normally have a lot of acne and pimples on their face. It is due to certain hormonal problems. So this drug was supposed to cure the severe and painful acne to the women, and the women who took this drug, they were reported to have the children with birth defects including facial deformities, heart defects and also mental retardation. Diethyl stilbestrol. This drug is synthetic estrogen which inhibits ovulation by affecting the release of pituitary gonadotropins, and it is used in the treatment of hypogonadism. Tetracycline. So this is an antibiotic and it has the ability to cross the placental barrier, and these constituents, it will be deposited in the bones and the teeth of the growing fetus. So that is why when these children are born, they can have yellow stained teeth and also certain bone disorders. It is all due to tetracycline. Anticonvulsant agents. The therapeutic drug phenytoin, this can cause fetal Hydantoin syndrome. It will result in microcephaly, that is a small head, mental retardation and also intrauterine growth retardation, which is referred to as IUGR. Anti-neoplastic or chemotherapeutic agents. These drugs can stop the rapidly dividing cells during fetal growth formation. So it should be totally avoided during pregnancy. Alcohol. The women who consume alcohol during pregnancy, they have given birth to children with mental and physical retardation. Fetal alcohol syndrome, this has been observed when the fetus is exposed to alcohol in utero, and the most critical period for this alcohol syndrome is the first trimester, that is the first 3 months. So these babies who have these fetal alcohol syndrome, they have small body size, low birth weight, craniofacial defects, psychomotor defects, microcephaly, scoliosis, small eye openings and other neurological problems. They can also have several visceral effects associated with the heart and the kidney. Learning disabilities may also be present. Non-chemical teratogens. So there are also other non-chemical teratogens. For example, certain viruses, they can also harm the developing fetus. Rubella virus, it is also known as that causing the German measles. It is hazardous and it causes teratogenic effects. This was reported as early as 1941 in Austria. That is why now the women are given this German measles vaccine, that is a rubella virus vaccine is given to prevent this disease. The defects produced vary with the stage of exposure. So exposure to the virus, normally they say it is the first 2 months of pregnancy, and that can cause heart and the eye anomalies. And also biological infections like the teratogens, they can include the cytomegalovirus, varicella, herpes simplex, then toxoplasma, syphilis and also HIV or the human immunodeficiency virus. Physical agents. Some physical agents cause teratogenicity. They include ionizing radiation, hypothermia and so on. Ionizing radiation can harm the growing embryo. It can result in cellular death and injury to the chromosomes. Some women who were exposed to the radiations in Hiroshima atomic bombing, they had the children with brain defect, and in the same way X-rays can also cause risk to the developing fetus. Environmental toxicants. Some environmental toxicants like organic mercury compounds, polychlorinated biphenyls, agricultural herbicides and industrial solvents, they are reported to cause teratogenic effects. So the people who had consumed the organic methyl mercury contaminated fishes in Japan, they had the children who were born with these birth defects. Maternal health factors also play an important role. Mothers who have diabetes can have an increased risk of children with congenital heart disease, renal and gastrointestinal and central nervous system anomalies. Women with phenylketonuria, which are biochemical and hormone disorders, they can have an increased risk of giving birth to children with mental retardation, low birth weight and congenital heart disease. Therefore, genetic factors play a very important role in teratogeny. Drugs of abuse. The drugs for abuse are highly risky to the developing embryo. Cocaine, for example, or benzoyl methyl hexonine. It is a teratogen and it is an alkaloid which is extracted from the plant Erythroxylum coca. Exposure to this drug, it causes gastrointestinal anomalies, cardiac problems, craniofacial anomalies, tissue death due to disruption in blood supply to the developing embryo. Opioids. This can cause preterm deliveries, that is before term the children can be born. Chorioamnionitis, which is causing there is a chorion and the amnion, the layers of the placenta that will be infected, neural tube anomaly and also fetal death. Cannabis is another drug that can cause low birth weight in the children and shorter gestation periods. Amphetamine and hallucinogens. So this can cause the microcephaly, oral cleft palate defects, and the hallucinogens definitely they can cause like the lysergic acid diethylamide and also phencyclidine. So this can cause microcephaly, intracranial abnormalities, limb defects and also eye abnormalities. Inhalants like industrial solvents, toluenes, fuels, anesthetics, and the women may be exposed to these substances at the industrial workplace. Also those who are dealing with the anesthesia and anesthetics, they can also have certain problems. So toluene can cause preterm labor, intrauterine growth retardation, microcephaly, craniofacial abnormalities, wide nasal bridge, blunt fingertips and abnormal palmar creases. That is the crease that you are finding in the palms. So they can have abnormal creases in their palms. Therefore, teratogenicity, it refers to the manifestation of developmental toxicity representing a particular case of embryo or fetotoxicity by inducing structural disorders in the fetus. The principles that are involved in teratogenesis. There are critical stages of the fetal development. So, the stage of the fetal development is an important factor. The dosage of the drug, the chemical or the radiation or the viral agent, that is important. Genotype, that is a genetical constitution of the mother and the embryo, are again important factors. Teratogens can cause toxicity to the growing fetus, and broadly they can cause death to the developing fetus in utero, malformation of the fetus, intrauterine growth retardation and functional defects in the newborn. Mechanism of action. So, a teratogen can cause effects on different intracellular components during the various stages of pregnancy. In general, there can be 4 main levels or areas where the action can take place. First, they can act on the intracellular compartment that lies between the nucleus and the cytoplasm. Then, they can act on the cell surface by giving rise to structural and functional anomalies. They can act on the extracellular matrix. They can act on the fetal environment at the organism level or in the feto-maternal relation. These can be further divided into genetic and the non-genetic types. Intracellular genetic, this is known as the inborn errors of metabolism. So, largely a mutant gene will lead to a deficiency of an enzyme activity. So, a metabolic pathway is blocked. One example is the Hurler syndrome. This is due to the deficiency of the lysosomal enzyme, and therefore the accumulation of heparin sulfate and dermatan sulfate occurs in the cells. The excess metabolite accumulation in the cells, that will lead to growth retardation, mental regression, skeletal defects, cardiac problems and also hepatosplenomegaly. Non-genetic. In this, the nuclear cytoplasmic interactions are blocked by the inhibitors. The inhibitors prevents the process of reading the genetic information. Thereby, they can cause certain hereditary disorders. One example is actinomycin D, and that is reported to be teratogenic to the early brain, and it can cause severe eye defects. The drug cycloheximidine, this can stop both the protein synthesis and also morphogenesis. Extracellular matrix. Teratogens can also affect the function of a tissue by interfering with the production or maturation of this extracellular material. One example is the dermatosparaxis. It is a hereditary disease which is detected in the cattle with fragile skin and an inelastic dermal tissue. So, this is due to abnormal or insufficient production of collagen in the dermal connective tissue. Non-genetic. The example of the antibiotics of tetracycline, this comes under these effects. They act on the extracellular compounds, and the drug tetracycline gets into the mineralizing tissues. Then it causes hypoplasia and also growth retardation. The action is well known on the bone mineral tissues. So, that is why it is affecting the teeth and the bone tissues. Fetal environment is also important. So, embryogenesis and fetal development is controlled by various factors. They include the maternal, the placental, the autogenetic factors. They are the hormonal factors, immune mechanisms and also nutritional factors. Teratogens can cause changes in the fetal environment without crossing the placenta. These agents can block the supply of nutrition or vital necessities to the growing fetus, and thus they can bring about the growth or the birth anomalies. Therefore, summarizing this lecture, we have understood the various sources of the teratogens and how these environmental toxicants and the toxins can actually bring about the intrauterine growth retardation. They can interfere in the fetal developmental process, and they can bring about even embryonic lethality and death of the fetus. In the same way, the environmental toxicants and also certain other therapeutic drugs and radiations that the mother is exposed to, also the hereditary factors, genetics of the mother also plays a very important role, and the fetal environment is controlled by several factors. Therefore, all this can have the effect on the growing fetus, and from the process of like embryogenesis to the organ formation, that time also if the fetus is exposed to certain toxicants, then again they can have certain eye and ear abnormalities, or they can have the shortening of the limbs, the cleft palates and so on. So, there can be morphological and structural defects, and they are observed at the time of birth, and all this can be controlled, and this can well be taken care of by proper counseling from the doctors, from the medical practitioners and the medical counselors, and they will help you to overcome these factors, and how we can very well protect ourselves from the environmental toxicants and the toxins also from the unknown origin and so on. So, hope you have had a good understanding of teratogens and the principles involved in teratogenesis, and how the fetal lethality is carried out by environmental toxicants. Thank you for your patient listening.